According to the National Institute of Mental Health, depression is a common but serious mood disorder. It causes symptoms that affect how you feel, think, and handle daily activities such as sleeping, eating, or working. Depression is feeling sad for no reason or having no motivation to do anything. The symptoms of depression are persistent sad, anxious, or empty mood, feelings of hopelessness, pessimism, feelings of guilt, worthlessness, helplessness, loss of interest or pleasure in hobbies and activities that were once enjoyed, decreased energy, fatigue, being slowed down, difficulty concentrating, remembering, making decisions, insomnia, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicide, restlessness and irritability. At least 5 of them should last for more than 2 weeks. Depression is associated with low levels of catecholamines, epinephrine, norepinephrine, and dopamine, and serotonin in the brain. The classes of antidepressant agents are monoamine oxidase A inhibitors, tricyclic antidepressants, selective serotonin reuptake inhibitors, and serotonin norepinephrine reuptake inhibitors. Serotonin, norepinephrine, epinephrine, and dopamine, these 4 neurotransmitters share the same skeleton in their structure, which is aryl ethyl amine. The treatment of depression depends on high level of serotonin and or catecholamine in the brain, either by blocking the enzyme responsible for their degradation or blocking the transporters responsible for their reuptake. The monoamine oxidase A inhibitors inhibit the oxidative deamination reaction, preventing the metabolism of serotonin, increasing the level of serotonin. Tyramine is structurally similar to biogenic amines found in cheese, banana, and wine, degraded by monoamine oxidase enzyme. The cheese effect is a food-drug interaction associated with people under treatment with monoamine oxidase A inhibitors when they ingest food rich in tyramine. Tyramine is a vasopressor. It displaces norepinephrine from storage vesicles, increasing the release of norepinephrine, and it is converted into norepinephrine by 2 steps of hydroxylation. At the same time, monoamine oxidase A is responsible for the degradation of both norepinephrine and tyramine. Using a reversible monoamine oxidase A inhibitor, norepinephrine and tyramine will not be metabolized, increasing the levels of norepinephrine, causing hypertensive crisis. The side effects of monoamine oxidase inhibitors are orthostatic hypotension, weight gain, and sexual dysfunction. According to their chemical structure, the non-planar butterfly conformation due to the 7-membered middle ring. They inhibit the reuptake of serotonin and norepinephrine. They block the transporters responsible for the reuptake of norepinephrine and or serotonin, increasing the levels of norepinephrine and serotonin in the synaptic cleft, increasing the interaction with norepinephrine and serotonin receptors. The tricyclic system has affinity to other receptors responsible for the side effects. The interaction with the anticholinergic M1 receptors lead to constipation, blurred vision, dry mouth, and drowsiness. The tertiary amine tricyclic antidepressants are used for the treatment of nocturnal enuresis. It has high anticholinergic side effect. It decreases the urinary bladder sphincter relaxation, decreasing urination. The interaction with the histamine receptors leads to weight gain and drowsiness. The interaction with the alpha-1 adrenergic receptors leads to dizziness, drowsiness, and decreased blood pressure. In the selective serotonin reuptake inhibitors, there is no tricyclic structure. This breaks the anticholinergic pharmacophoric moiety, leading to less anticholinergic side effects. The side effects of serotonin reuptake inhibitors are gastrointestinal bleeding and disturbances, nausea, vomiting, sexual dysfunction, sleep disturbances, and mania. Venlafaxine has no effect on muscarinic or histaminic receptors like tricyclic antidepressants. It increases the norepinephrine levels, increasing the blood pressure, heart rate, and CNS activation. Mirtazapine blocks the presynaptic alpha-2 autoreceptors, increasing the norepinephrine and serotonin release. It also blocks H1 receptors, leading to sedative effects.